ever seen someone with red, scaly patches on their skin? That person likely has a skin disease called psoriasis. According to the Journal of American Medical Association, psoriasis is a common disease that affects more than 7 million people in the United States. Today I'm going to go over some of the symptoms, causes, and treatment options that there are for the skin disease. This research has primarily been collected from 3 sources. As I quoted already, the Journal of the American Medical Association, also the British Journal of Community Nursing, and last, the National Psoriasis Foundation. So first, let's start with the symptoms and occurrence of psoriasis. So in an article posted in the British Journal of Community Nursing, it listed plaque psoriasis as the most common type of this skin disease. Plaque psoriasis is a non-contagious disease characterized by red scaling plaques. This happens when the skin cells turn over much faster than normal skin cells. Normal skin cells are generally turned over in 28 to 30 days, but in affected skin, those same skin cells turn over in 3 to 5 days, causing a lot of buildup. And I've got a little bit of a diagram here, or a chart, to show you some of the scaling that can present. It's up here. You have your regular skin in this area and your skin surface. And here you see the buildup of plaque that starts to come from those skin cells that are turning too fast. So these plaques are commonly found on the elbows, knees, lumbar back, on the scalp, sometimes in genital areas, on the palms, the soles of the feet, joints, and in nails. Psoriasis is an autoimmune disease that affects approximately 1 to 3% of the population. The National Psoriasis Foundation names 5 types of psoriasis. I've already discussed the plaque form of psoriasis, but there's also other types called guttate, inverse, pustular, and erythrodermic. The most common, as I mentioned before, is plaque psoriasis, and that occurs in approximately 80% of all cases. So what causes psoriasis? A lot of research that has been done, and a lot of this was pulled from that National Psoriasis Foundation, shows that it is a genetic or inherited disease. It's definitely not contagious, and it is tied directly to the immune system. Psoriasis can go through different stages. There can be both dormant and flare-up stages. The flare-ups can be caused by many triggers. Some of those triggers include stress, alcohol, sunburn, or even some sort of a skin infection. And then there are also some medications that people may take that can worsen the condition of psoriasis. So what treatments are there for those people who suffer with psoriasis? There are 3 primary types of treatments. So there are treatments that work within your body, and those are called systemics or biologics, which are normally taken orally or intravenously. Then there are treatments that work outside your body, and those are generally topical treatments such as corticosteroid creams or ointments, or another option is phototherapy, which involves exposure to light from ultraviolet light machines. There are also a few less common and more alternative treatments out there today as the study of psoriasis continues to grow. So some of those different therapies include supplements, aromatherapy, yoga, meditation, and really it's anything to calm the mind and relax the body, and it's for those who truly want to avoid the traditional type of treatment. And then another big alternative that has become very popular is the alternative treatment, which focuses on a diet and exercise. So knowing what your triggers in your diet are and avoiding those type of foods, and definitely getting that exercise similar to the yoga or other areas that may stimulate your body more and help your immune system. So in summary, psoriasis is not a common disease. However, 1 to 3% of those people that it affects it can really take over their life. And for those affected, there can be a lot of triggers. For those people who are affected, getting to know their body and learning their triggers can really help them to better manage this disease. And along with those many treatments that are available today, it's a much more positive outlook. So personally, as a longtime psoriasis patient, I've had a lot of experience with this disease. And I know that my stress and my diet are my main triggers. So I'm constantly working to manage these two areas of my life. And I'm also looking a lot more to non-traditional treatments to avoid a lot of the side effects that can come from those traditional style treatments. I believe that, like myself, the outlook for others who suffer from psoriasis has become more and more positive as the patient learns how to manage their cycle of dormant times and flare-ups, and also being able to use the combination or each one individually of the traditional and non-traditional treatments. And I also look forward to more treatments that may become available in the future. I hope this speech has been informative for you to learn a little bit more about psoriasis. And if you do have any questions about it, you can definitely go to the National Psoriasis Foundation website to learn more. Thank you.